Yeah, you're completely right. The therapies are mainly based on three pathways that have been described 20 years ago: the prostacyclin, the nitric oxide, and the thylline pathway. And all the medications we have are mostly vasodilators acting on those pathways, and new medications are needed. One purpose of the study that we did is by repeating the second nitric oxide challenge, one can test whether there is changes in plasticity of the lung. One would think that by giving these therapies, they may affect the characteristics of the vessel and make it a little bit more plastic, they have more vasodilation, but we couldn't see that. The study doesn't directly impact a patient, but it tells us that there are changes that occur over time, and that the therapies that we have right now are not acting very much on the remodeling of the vessels, obtaining what would be ideal, reverse remodeling up to normal. So newer therapies are certainly needed, emphasize the need for newer therapies that will act in a different way than the three ones that we mentioned, particularly decreasing proliferation and able to take the abnormal circulation to a normal one. There are several medications being tested that act in different pathways. I'm pretty excited with the study of the medications that activate the BMPR2 pathway, such as tacrolimus, sotatercept, those medications that have a more mechanistic target with good preclinical data. I think they have a good chance of success. There are also medications that work in metabolic pathways because the metabolism is altered with increase in the glycolysis. So medications that act in that sense may also be effective. And other medications that work on tyrosine kinase inhibitors may be very attractive. All those are more acting on the process of the disease, this proliferation, the thickening of the intima, the proliferation of the media and adventitia. So acting more on different pathways, more pathways that influence the proliferation, progression of the disease. I think it will be the future. Another agent, this distinctive from the three ones that we have, another group of medications will be very important for the patient in the future.